Right now, millions of people are walking around with a disease slowly destroying their lungs, and most of them have no idea. It doesn't announce itself with a dramatic moment. There's no sudden crisis. Instead, it creeps in quietly, disguising itself as everyday tiredness or the kind of breathlessness you'd expect after climbing a flight of stairs. By the time most people are diagnosed, the damage is already done. That disease is pulmonary fibrosis. And today, we're pulling back the curtain on one of the most misunderstood and underdiagnosed lung conditions in the world. So what exactly is pulmonary fibrosis? Let's break it down. Pulmonary refers to the lungs, and fibrosis means scarring. So pulmonary fibrosis is, at its core, a condition where scar tissue builds up inside your lungs over time. Think of your lung tissue like a soft, flexible sponge. It's designed to expand and contract with every breath, allowing oxygen to pass easily into your bloodstream. Now imagine that sponge slowly hardening, becoming stiff, thick, and rigid. That's what fibrosis does. As scar tissue replaces healthy lung tissue, your lungs lose their ability to work properly. Breathing becomes harder. Oxygen transfer becomes less efficient. And unlike many tissues in the body, lung scarring can't be reversed. Pulmonary fibrosis falls under a broader category called interstitial lung disease, a group of disorders that all affect the tissue and space around the tiny air sacs in your lungs. The most common and most serious form is called Idiopathic Pulmonary Fibrosis, or IPF. Idiopathic is a medical term that essentially means we don't know the exact cause. And that's what makes IPF particularly frightening. Doctors can't always point to a single culprit. But that doesn't mean we're in the dark about risk factors. Research has identified several important ones. Age is a major factor. IPF is most commonly diagnosed in people over 60. Being male also increases your risk. A history of cigarette smoking is strongly linked to pulmonary fibrosis, as is long-term exposure to certain environmental hazards, things like dust from wood, metal or stone, mold, and chemicals found in some workplaces. There are also genetic forms of pulmonary fibrosis that run in families, and in some cases, the scarring lungs we see in fibrosis can be triggered by other conditions like acid reflux, autoimmune diseases such as rheumatoid arthritis or lupus, or even viral infections. Now let's talk about what living with pulmonary fibrosis actually feels like. Because for many patients, the early symptoms are so subtle they're easy to dismiss. The most common symptom is shortness of breath, especially during physical activity. At first, it might just feel like you're a little more winded than usual. A persistent dry cough is another telltale sign. Some people notice their fingertips or toes becoming rounded and enlarged, a condition called clubbing, which happens when the body isn't getting enough oxygen over a long period. Fatigue is also common, along with unexplained weight loss and aching muscles and joints. The tricky part is that these symptoms can overlap with so many other conditions, from heart problems to plain old aging, which is why interstitial lung disease is frequently missed or misdiagnosed in its early stages.
Getting a proper diagnosis usually involves a combination of tools. A chest CT scan is often the most telling. It can reveal the characteristic honeycomb pattern of scarred lung tissue. Pulmonary function tests measure how well your lungs move air and exchange oxygen. Sometimes a lung biopsy is needed to confirm the type of fibrosis and rule out other causes. So what can be done about it? Here's where the news is both sobering and cautiously hopeful. There is currently no cure for IPF or most forms of pulmonary fibrosis. However, two antifibrotic medications, nintedanib and pirfenidone, have been shown to slow the progression of scarring. They don't reverse the damage, but they can buy precious time. Pulmonary rehabilitation programs, which combine supervised exercise with breathing techniques and education, can significantly improve quality of life. Supplemental oxygen is often prescribed when levels drop. And for carefully selected patients with advanced disease, a lung transplant may be the only option that can meaningfully extend life. Management also means making lifestyle changes. Quitting smoking is absolutely essential. It's the single most impactful thing a smoker with fibrosis can do. Staying up to date with vaccines for flu and pneumonia protects against infections that can cause dangerous flare-ups. Staying active, eating well, and managing stress all contribute to better outcomes. Here are the key takeaways from today. Pulmonary fibrosis is a progressive scarring of lung tissue that makes breathing increasingly difficult. The most common form, IPF, has no known cause, but risk factors include age, smoking, and environmental exposures. Symptoms are subtle at first, which is why early diagnosis is so critical. While there's no cure, treatments can slow progression and improve quality of life, and awareness is your most powerful tool. If you found this video helpful, please give it a like. It really helps our channel reach more people who need this information. And if you're not subscribed yet, hit that subscribe button so you never miss an episode. Do you have questions about pulmonary fibrosis or another respiratory condition? Drop them in the comments below. We read every single one, and your question might just become our next video.